Shoulder pain can keep you up at night and from doing the things you love. If you're dealing with shoulder pain and are ready for a change, Dr. Kevin Kruse wants to see you. He joins me this morning along with Phil Anderson, who went to him for help. Good morning to both of you.
Good morning.
Great to see you both. So first of all, Phil, tell us about your decision to reach out to Dr. Kruse and how your shoulder was affecting you.
About 13 years ago, I tore the rotator cuff in my left shoulder and decided to have revision surgery, and I had a shoulder replacement, but it broke.
Oh my goodness.
And I had a great deal of pain 24 hours a day, had trouble sleeping at night. I couldn't move my arm more than about like this. It's hard to do things with just one arm. So I finally decided to see a doctor and have a revision surgery done. I didn't know who to talk to, and so I went and talked to the doctors I know at Texas Orthopedics Associates, and I know and trust them, and they recommended that I talk to Kevin Kruse.
And so, how are you today?
It's amazing. Absolutely amazing. I didn't realize what a difference this would make in my life, but with the surgery he gave me, I was able to recover the full use of my left arm. After the surgery was over, he told me that it was one of the most complicated surgeries he'd ever do, because for 13 years I suffered nothing but muscle atrophy, and he had to compensate for that.
I bet that's the truth.
But the recovery was easy, and within 3 months I recovered full range of motion in my left arm.
Well, Dr. Kruse, this has to make you feel wonderful to be able to do that. You say you've helped more than 5,000 people get their lives back. What makes your practice unique, and what can someone expect when they come to you for help?
I think if you're trying to get to kind of, I think there's a lot of things that make us unique, but at the core of it all really is that, you know, we have a constant drive and passion to evolve and change, right? So we're never satisfied with what we're doing right now. We're always looking for the next step, the next way to get better at what we do. And that has, you know, created, you know, many innovations in our practice. And for example, we have a technique now where we can replace a shoulder without cutting any of the muscles around the shoulder. Okay, so the standard techniques, you have to cut the muscles. This newer technique allows you to not cut the muscles around the shoulder, which allows you to not wear a sling after surgery, have full use of your arm right away, and you can do the surgery same day, go home same day. So that's one example. Another one is, you know, we use artificial intelligence-based computer platforms to map out and plan the surgeries. And I use this in Phil's case as well to help me kind of understand the anatomy a little better. And then you get customized implants designed for the patient, and what that allows you to do for the standard replacements is do them in really less than 30 minutes, which is, you know, great for patients for a myriad of reasons. So those are two examples of things we do, but I think that the core of it is that we're always changing, we're always evolving, we're always getting better.
It has to be really rewarding, as I said. What would you say to someone who's watching if they're having shoulder problems?
You know, I would say come in and see us. There are very few problems in the shoulder that we can't fix. It's rare. And so 99% of the time when someone's having pain in the shoulder, the first step is to figure out what the problem is. And I'm biased, but I think that the best person to do that is someone who spends their entire life all day, every day looking at shoulders.
Okay, just real quickly before you get away, what is it about your background that helps you treat shoulder issues so well?
Two things. I think, you know, I played sports in college, I played football, so I had several injuries, and I've had surgery on my own shoulder twice. So I think that gives me a unique perspective. The second is I was very blessed to have trained underneath who was widely regarded as the best shoulder surgeon on earth, is a surgeon named Gilles Walsh in France. And that experience with Dr. Walsh, not just what he taught me about shoulders, but what he taught me about life and how to think, greatly impacted my life. And you know, he recently retired, and but that time that I spent with him, it wasn't just about the nuts and bolts of surgery. It was a way to think about your practice and how to evolve, and that's what he taught me, and the time I spent with him was incredible. So I think those two things have really shaped me quite a bit.
Well, Phil, I know that you and 5,000 other patients at least are very, very glad you've seen Dr. Kruse. Thank you both for coming in today. Appreciate it. Dr. Kruse has offices in Dallas and Plano. Go online to book your appointment today at drkevinkruse.com, or here's the number to call, 214-617-0577.